It's been 1 year since a Utah doctor died by suicide. Those who loved him the most are demanding change on Utah's Capitol Hill. For Healthy Mind Matters, Heather Simonson explains how they hope a proposed law could help save lives.
I'm gonna get a little suntan on my face.
Someone's missing on this Bluebird Day.
He enjoyed it so much up here.
Jackie Jolly's husband, Dr. Scott Jolly, loved to ski here. He was an emergency physician at Intermountain Healthcare.
We enjoyed riding the gondola, memories of us being happy, enjoying our family, our kids.
But life took a turn during the long hours and added stress of the pandemic. A mental health crisis followed.
We had him admitted to the same facility that he worked at, and it was a disaster.
Scott's own hospital system was his only option covered by insurance. But Jackie says being treated by his colleagues was extremely difficult for her husband.
What kind of gossip is going to be talked about in the hallways, or what are my colleagues that I'm constantly consulting on patients, what are they going to think of me?
Miles Greenberg, Scott's best friend,
here's one for you, Miles,
said Scott did all he could to be released and days later died by suicide. That's why they want to expand access to coverage for medical caregivers.
It's a barrier for people seeking help that are on the front lines of health care.
Scott's death inspired House Bill 278, which would require insurance companies to cover out-of-network mental health care for medical caregivers.
They're people too, and we need them to be in as good of shape as they can because they're taking care of all of us.
Physicians have a much higher chance of dying from suicide than their patients. 300 to 400 doctors die by suicide each year in the U.S., or about a doctor a day.
Physicians are taught to care for others, but are not necessarily taught to care for themselves.
Dr. Mark Rappaport says that, along with the high-pressure nature of medicine, puts staff at risk. He says giving them flexibility in mental health care will save lives.
It will allow them to be better providers of care. It'll allow them to have richer lives. It'll allow them to be better parents.
Changing the system is a tall mountain for Jackie and Miles to summit. But they say if Scott could have gone somewhere else for treatment, this Bluebird Day wouldn't be so lonely.
I think that he would be here today.
For Healthy Mind Matters, Heather Simonson, KSL 5 News.
Heather, thank you. The bill has been assigned to a committee but hasn't been scheduled yet for a hearing. If you or someone you know needs help, call the suicide prevention line at 1-800-273-8255 or the Huntsman Mental Health Institute crisis line at 801-583-2500. If you're a healthcare provider, you can also download the Safe UT Frontline Crisis text line app for immediate assistance.